All right, so we are good. So let me go ahead and see how I'm going to do this. All right, so obviously it's a webinar, so you don't have to silence anything. You're watching me on Facebook, and that's all good. All right, so we are coming right in. Just make sure I've got everything I need here. Okay, so yeah, great quote. Hey, it's Dr. Green. I'm just going to pause this for a second. We will cut out the beginning and intros as always with this, but I'm going to go ahead and get started, and hopefully we'll have a great turnout on Facebook Live. Welcome. It's Dr. Green. We are talking about integrative cancer therapy today. It's an integrative approach to cancer treatment with what we call neurometabolic care. I am just going to give you a quick background on myself. I am a doctor of natural medicine. I am fellowship trained in integrative cancer therapy. This is through the University of South Florida Medical School and an organization called A4M, the American Academy of Anti-Aging Medicine. And I am board certified in integrative and anti-aging medicine. I am a certified functional medicine practitioner. I am certified in functional neurology, and I'm currently enrolled in Dr. Daniel Amen's Brain MD Brain Health University clinical functional neurology program. I have studied integrative cancer treatments under Dr. Kevin Connors and Dr. Mark Rosenberg, who is the current chair and head of the Fellowship in Integrative Cancer Therapy, which I've completed. It is the only fellowship in the country that is endorsed and supported by the American Medical Association in alternative or integrative cancer treatment, which is pretty awesome. It's pretty great to have gone through that program, and that really brings me the reason why I'm here with you guys today. We are talking about how to help our cancer patients. So a couple things for us to know tonight. Number one, I do not treat or cure cancer. I am not an oncologist. We're here to get people better that do not have anywhere else to go. And we exist for those who can get no help anywhere else. I oftentimes see people who come to us as a last hope. And medicine has failed them, and they're looking for other options that many times work and work better than medicine, and it should have been a first choice, not a last choice. All right, so cancer touches everybody. I have lost family members to cancer. I'm sure many of you have as well, or some of you may be fighting cancer yourself. And 1 in 2 Americans have cancer. And we can go back 40 years to President Richard Nixon. He signed the National Cancer Act on December 23rd, 1971. He said, "I will ask for an appropriation of an extra $100 million to launch an intensive campaign to find a cure for cancer. And I will ask later for whatever additional funds can effectively be used. The time has come in America where the same kind of concentrated effort that split the atom and took man to the moon should be turned toward conquering this dread disease. Let us make a total national commitment to achieve this goal." And again, that was almost 50 years ago. And if we look at this, in 1950, heart disease was a much bigger killer than it is today. We see that there's a huge reduction in heart disease in our country, cerebral vascular diseases, huge improvement, influenza and pneumonia, huge improvements. Cancer has not changed that much, and this is from 1950 to 2005, and the stats have really not improved that much in the last 14 years. So what we know is that chronic disease in the U.S. is increasing every year. Most cases are not diagnosed. Most cases continue to progress, and we are losing the war on cancer. Between 1975 and 2001, in the U.S., cancer has really changed. And this is the thing. In 1971, 1 in 20 people got cancer. Today, 50% of the U.S. population will get cancer in their lifetime. It's 1 in 2 people. The incidence of cancer overall is up 18.2%. The death rate is up slightly, 1.3% from 1975. But there's been no significant changes in survival in the last 25 years. This was published in a peer-reviewed medical journal, CA Cancer Journal Clinicals. And this is a peer-reviewed journal in the PubMed. This study is a landmark study that we're going to reference again in a little while. All right, so what is cancer? All of the cells in our body are replicating. They're constantly reproducing. And cancer is when a cell does not die off. This is called apoptosis. And it continues to grow. We're going to talk about a couple of different genes that we have. There's something called oncogenes. An oncogene is a gene that has the potential to cause cancer. This is a genetic marker. In tumor cells, they're often mutated or expressed at higher levels. Tumor suppressor genes, or anti-oncogenes, are genes that protect a cell from one step on the path to cancer. Oncogenes have more than 100 different varieties. Some common oncogenes, some of you may have heard of, the HER2 new oncogene, you may have heard of being HER2 positive in breast cancer, BCR-ABL, which is a chronic myelocytic leukemia, or B-cell acute lymphocytic leukemia. CMYC is Burkitt's lymphoma, NMYC is small cell lung cancer, and neuroblastoma. Tumor suppressor genes, on the other hand, detect inappropriate growth in cells, and there's some examples like the P53 gene prevents replication of damaged DNA and promotes apoptosis. Retinoblastoma gene, or RB gene, regulates DNA replication. So with oncogenes and tumor suppressor genes, in a cancer patient, they have a higher level of oncogenes that are turned on and a higher level of tumor suppressor genes that are switched off. In a non-cancer patient, they have a higher level of tumor suppressor genes turned on and a higher level of oncogenes turned off. Our goal is to turn oncogenes off and tumor suppressor genes on. And we do that, we got to dig in a little deeper. So what is cancer? Classification of cancer. There's different categories of cancer. Cancers are named according to the organ in which they originate. Even if a cancer metastasizes to another part of the body, it keeps its original name. Now, cancer names such as breast cancer, brain cancer, lung cancer, skin cancer are examples, but cancer names can also be based on the type of tissue affected. We're not going to go into detail into the 6 major categories of cancer other than to list them here. So carcinoma, sarcoma, myeloma, leukemia, lymphoma, mixed types, and then there's hundreds of different cancers that exist in these different categories. So our goal is not to treat or cure your cancer. No, my goal is to increase the function of your immune system so you have a higher level of tumor suppressor genes switched on and a higher level of oncogenes switched off. What I do is to help you find the most effective natural protocols to enhance your immune system in its cancer battle so that you have the best chance possible living a long and happy life. So there are natural protocols that we can increase or switch on your tumor suppressor genes and switch off your oncogenes. How do we do this? Well, by increasing the function of your immune system. So there's 2 main parts of our immune system. This is a simplistic view, but we're going to use this. We call them Th1 and Th2. Th1 is the Pac-Man of the body. Th2 are going to be antibodies that remember the bad guys. So the 2 systems, Th1, Th2, should always be in balance. And what happens in cancer is cancer cells produce killers to your Th1 system, literally striking at your immune system's ability to fight and protect itself. So how do we fix this? Well, traditional approaches to cancer kill cancer cells, right? Chemotherapy, radiation. We can remove the cancer. Natural chemotherapy, immune stimulation, immune regulation, detoxification. How about waveform excitation? Well, gosh, there's a lot of things in oncology, there's a lot of things in medical management that patients can use, and their doctors they go to meet with have told them what to do. What's a person to do? There's a problem with the traditional approach only. Fear is the primary motivating factor for initiating operative chemo and or radioactive care. Cancer surgery decreases perioperative immunity, which actually supports cancer growth and metastasis. A possible spread of cancer cells intraoperatively. So when you go in and you cut into a cancer cell, you have the potential to spread those cells. Possible removal of tumor growth inhibition factors by removing the primary cancer, leading to increased metastasis or accelerated metastatic tumor growth. So if you have metastasis, if you have cancer that originates from your one organ of your body, and you go try to remove that organ, the cancer actually may be not spreading because that organ is actually holding it, it's inhibiting it to a certain extent. So there's a problem with removing the primary tumor at times if there are other potential tumors. Now, chemotherapy also slows down a fast, rapidly growing cancer by suppressing the immune system. So the goal, right, is to kill the cancer before we kill the patient. It's a form of poison. The problem with this approach, oh gosh, chemotherapy is going to also affect our immune system. So if we look at this study in clinical oncology in 2004, the contribution of cytotoxic chemotherapy to the 5-year survival in adult malignancies, traditional cancer treatments have extended overall survival rates by approximately 2 months in the last 50 years. That's it. And again, published in 2004, 15 years ago, it was found that the contribution of traditional chemotherapy only makes a minor contribution to cancer survival in adult malignancies, estimated to be 2.3% in Australia and 2.1% in the US. This is unacceptable. What we're basically saying is, in other words, chemotherapy doesn't work and traditional oncology is not saving nearly enough lives. Even with chemotherapy and radiation, the problem is still the presence of circulating tumor cells and cancerous stem cells, which are not eliminated. So the cancer is gone, but the patient develops cancer years later in another area of the body. Well, nobody's asking the question, why did the cancer start in the first place? Even after billions spent, the reality is that we are losing the war on cancer. So research supports this concept that I'm saying. And if you think what I'm saying is just my opinion, there are study after study after study. Manipulation of tumor actually releases tumor cells into the bloodstream. These are called circulating tumor cells, or CTCs. Removal of the primary tumor, and therefore lack of factors to inhibit angiogenesis in remote locations, which can lead to metastasis. Local and systemic tumor growth factors and tumor-promoting cytokine release from tissue injury during surgery. And how about suppression of cell-mediated immunity, which is the Th1 system? We've got 4 studies here that help to support this. The truth is, according to the Journal of Oncology, a peer-reviewed medical journal, the average cancer patient is worth nearly $300,000 to the hospital and doctors who treat those patients. I hate to paint such a grim picture. I must make it perfectly clear that I'm not against all chemotherapy or radiation. In fact, I think that immunotherapy has some awesome, amazing, new possible treatments that we are seeing promise with in the world of medical management. But to ignore and often negate alternative approaches aimed at promoting the patient's internal environment, their maximum healing potential, it's just plain wrong. Cancer and money. What does it compare to? I mean, there are other approaches in this huge bill that is there for a system that is incomplete, for a system that uses only one method that does not have the survival rates changing over 50 years. We got to look elsewhere. So the problems with the traditional approach only have been talked about. There are so many books that are out there. Great books. Outsmart Your Cancer is a great book. Knockout, Suzanne Summers, one of the epic books that's out there. Max Gerson, The Cancer Therapy, The Gerson Method. ESSIAC, Toxic Treatment, Surviving the Cancer Wars, Penny Williams. A lot of really great books are out there. The key thing is, you got to ask, hey, is there really a cure? Is there really an alternative that works, that medicine isn't doing? A good dear friend of mine, Dr. Kevin Connors, said the serious clinician will come to the conclusion that successful supportive care of someone diagnosed with cancer will be defined as converting it from an acute terminal disease to a chronic manageable disorder. Very importantly, there are natural protocols that can increase or switch on your tumor suppressor genes and turn off your oncogenes. There are natural protocols that can accomplish what we are trying to accomplish with your cancer. But many people don't realize that natural remedies or protocols can also make your cancer worse. If used incorrectly, natural protocols can actually increase your oncogenes and decrease your tumor suppressor genes. It's very serious, and it's literally life and death. So the patient example, patient was taking pine bark extract, green tea extract, grapeseed extract, and their cancer got worse. Well, all of those are Th2 supports. Resveratrol, pycnogenol, lycopene, caffeine, grapeseed extract, green tea, pine bark extract, they all push the immune system along a pathway called Th2, and this could worsen your cancer. Th1 support, vitamin A, vitamin C, zinc, astragalus, echinacea, licorice, lemon balm, maitake mushroom, other medicinal mushrooms, garlic. So how about the patient was taking protocell, which targets anaerobic cancers, and his cancer got worse. The patient was taking IP6, inositol 6-phosphate, and her cancer got worse. The patient was doing the Gerson method, and his cancer got worse. All three of these should be curing cancer, should be shown to help. Studies show each of these tools can improve cancer in patients, but their cancer got worse. Why? Because you have to know about immune regulation. You have to know what the patient's immune system is doing in order to know what type of supplements will work for them. How do we know, right? Patient comes to me and says, I have X type of cancer. What is the best natural protocol? Off the top of your head, which natural therapy is best for me? There are so many alternative approaches. Which one works best for you? Well, let's talk about some of these methods. There's methods that heal. The Gerson therapy is a therapy that is based on concepts of juicing, very high dose juicing to help promote a more alkaline environment and provide enzymes that can help to heal. Utilization of coffee enemas that can help to improve liver and bile flow and see improvements in function and detoxing, as well as very specific diet. What about, does it work? Yeah, for some patients, we show that Gerson has cured them. For other patients, we show that it doesn't. What about Dr. Kelly? Dr. William Kelly wrote a book, which was a self-test for the different metabolic types. And he's found a way in the 1950s to cure cancer. For some people, it works great. His diet is a diet that I still use with some patients today. It is an inexpensive way for us to assess whether you should be eating meat, vegetables, a combination of the above, dairy, or anything else. And it gives us some great insight into what you should be putting in your body. But not for everybody, right? How about diets? Budwig diet, the detox flaxseed diet, eating God's way for cancer. Dr. Kelly's enzymes and metabolic typing. Dr. Gonzalez with mega dose of vitamins like vitamin C. Gerson therapy, SEAC tea. Dr. Tullio Simoncini, who used funguses and molds to cure cancer. The Hoxsey method uses tonics. How about IV vitamin C? How about Hulda Clark, who felt like parasites and flukes were causing cancer, and treat that and that improves? How about Dr. Connors? Stop fighting cancer, start treating the cause, right? All these different things are protocols that are out there. What's the best approach for the individual patient? My approach is an integrative approach. Cancer is the ultimate chronic illness. Your body has been sick for years, and now you have a label. Well, that cancer, that lung cancer, that colon cancer, that prostate cancer, that breast cancer, that brain cancer, that spine cancer, that whatever the cancer is, whatever they've given you, the name, lymphoma, leukemia, or anything else, you name it, that is just the name. And there are things happening behind it that are driving to that name. So we're all dealing with what we call a web of physiological dysfunction. Nobody in here has just one problem. That's not really how our body works. That's not physically what happens. So when we look at your web of physiological dysfunction, gosh, you've got certain things that we have to fix, all right? There's certain health breakers that we have to address. Your gut, first and foremost, gut dysfunction, 80% of the immune system we have to address. That is key, number one, and absolute essential. Number two, blood sugar dysregulation. We have to make sure that your blood sugar is working where you want it to. Number three, inflammation. We have to make sure that your body is doing what we want it to from inflammation. That is essential. How about autoimmune? We have to address the immune system. We have to make sure that your body, if it's attacking itself, that we fix that. We have to fix your body from attacking itself. How about methylation or genetics? That's another key thing right there, okay? We need to make sure that your body has the ability genetically to support itself. If we don't do that, gosh, then no matter what tools we use, they may not work. Anemia, so red blood cell dysfunction is something we have to look at. What about liver gallbladder function? Thyroid function? These are all things we have to do. Fatty acid metabolism problems, carbohydrate metabolism problems. Each of these pieces we have to do. Energy production markers. EMFs, have you heard of electromagnetic field radiation? So like your Wi-Fi, your cell phone signals, things that are out there that can drive and cause your body to get attacked. Cell phones should not be against your ear directly. It actually we're told that can cause cancer. We're told that can actually cause cancer. So each of these pieces, we want to make sure we are not addressing and leaving on the table. We want to make sure that they're all getting addressed properly. Dental work, that's another one. Root canals, that's a huge thing that I've seen patients drive and have, I believe, their cancer caused by root canals. Toxicity issues. All of these need to be functioning optimally for you to achieve maximum healing. So we're talking about a balanced immune system. For an internal threat, you have an autoimmune problem like type 1 diabetes, rheumatoid arthritis, psoriasis, MS, or lupus. Or if there's an external threat, like an allergic reaction, hay fever, eczema, sinusitis, or asthma, well, the immune system can overreact and create these problems, or it can underreact and lead to issues from infections, viruses, bacteria, fungus, parasites. Well, the immune system can't fight them. It's underreacting. It's not getting rid of them. Or cancer, the immune system can't address it. Maybe hepatitis, maybe shingles, TB, or other diseases. It can't correct itself. So if we have these problems, it's either better, too strong attacking, or too weak, and it can't defend ourselves. So how do we know where you're at? Testing. So blood work. We can check blood sugar levels, liver, kidney, gallbladder markers, iron and ferritin levels, our B vitamins, something called methylation, which is a huge, huge driver. C-reactive protein, homocysteine, can lead to methylation issues. You can also see issues with vitamin D. Low vitamin D is classic for autoimmune patients, classic for cancer patients. Your thyroid, there are 10 tests for your thyroid, not one, but 10 tests that we should always look at. And then lipids, your cholesterol levels. Well, what about food sensitivities? So many people know about foods, but we really have to check and see, are foods creating an issue with you? If they are, then you know what, we need to make sure that we know which foods are safe for you and which ones are not. We're also going to look at Cyrex Array 5 is a test that I don't use too much, but I want to talk with people about it. So Cyrex Array 5 is an autoimmunity panel. It looks at markers in the body that can lead to your body attacking itself that we wouldn't necessarily see otherwise. Hey guys, I'm just kind of tying into Facebook as we're doing this presentation on 2 systems. But I just want to say hi to everybody and thank you all for coming here. Feel free to ask questions. If you type in questions or ask them, I'll try to answer them as well. But the wheat zoomer I want to touch on. So people can go get tested for celiac disease. And this is really important when we talk about, you know, a cancer patient, because what we eat is so important that it doesn't attack our body. And celiac testing comes back negative almost all the time. It really is a very, I think, a poor quality test. It only looks at 2 markers out of a wide range of markers that test for celiac, or gluten, I should say, test for gluten. There is a panel that I use that is called the wheat zoomer panel. And it looks at, first, something called leaky gut, which is gut function, intestinal permeability, or leaky gut. And there's multiple causes for leaky gut. So your immune system could be attacking your gut. You could have an issue with bacteria causing problems, or it could be a breakdown in the gates that keep toxins in the small intestine and outside of the immune system's responses. So depending on where leaky gut is coming from, you can have different things to treat it. And also the gluten panel. So with gluten, let me see if I can do this here, if it'll let me annotate. All right, so you have, good. You have wheat at the top, and then wheat turns into gluten and wheat germ and non-gluten wheat protein. Gluten turns into gliadin and glutenin. Gliadin turns into alpha, beta, gamma, omega, gluteomorphin, and proteomorphin. And glutenin has LMW and HMW. So here's the thing. When you test for celiac, you're testing like one marker right here, and that's it. Now what happens if these markers were positive or this marker was positive? The celiac test is going to be negative. Or I had a patient the other day who does not have any gluten issues, but has issues with wheat. So he can't eat wheat at all, but he actually didn't test positive for gluten. He wouldn't have known that based on the celiac test. So the whole goal is to do the right test to make sure that we can figure out what's safe to eat and what's not. Also, when we talk about foods, we know, there's so many different diets that are out there. we look at 92 different foods and, you know, meat, fish, dairy, grains, vegetables, fruit, legumes, and more. There are so many different foods that we need to test you for. But I will tell you quite simply, with cancer, the best diet that we have found is a high plant fat, low carbohydrate, moderate protein diet. There's a couple concepts that I don't have in slides here that I'll go to in a couple minutes. I want to touch on with you to come back to that. But we're really going to hammer where you should be eating and what you can do diet-wise. In fact, there's a new book that just came out, Curing Cancer with Food. And I think it's a great concept because it gives us the ability with the right diet. We know that we can stop cancer from getting worse. We've seen it happen over and over again. And there are so many treatments that are available for us. All right. Other testing that we do, organic acid testing. So fatty acid metabolism, carbohydrate metabolism, energy production, brain transmitters, liver detox markers. All of these things can be abnormal due to deficiencies or other problems contributing to what's going on with your health. How about stool testing? So the vast majority of cancer patients are autoimmune, and we need to find out what's causing their immune system to attack their body. It could be parasites, mold, fungus, yeast, bacteria, a virus. Several of the famous cancer fighters and authors out there have talked about fungus or mold being the cause of cancer. We see many different things drive it. It could be one or more of them. We have to test you to find out. All right, hormones. You have a chronic condition, your body's been under physical stress. So what's happening to your adrenal gland is incredibly important to your health. Hormones hormonal causes contribute to abnormalities in many cancers. Obviously breast cancer, testicular cancer, prostate cancer come to mind, ovarian cancer, things that could be the result of estrogen or testosterone imbalances. But it's more than that. The adrenal gland plays such a role in driving how your body can regulate and support itself. So the bottom line is the testing tells us what's wrong. And there are numerous supplements that we can use to help maximize your healing potential. Like I keep saying, they either help increase or switch on your tumor suppressor genes and decrease or switch off oncogenes. So what are some of the tools that are out there? Some of the supplements that have been shown to enhance tumor killing effects of immune cells. Medicinal mushrooms, cordyceps, hopo, red reishi, moringa oleifera, and turkey tail are all some of the mushrooms that we use in our clinic. Beta-glucan, protocell, hyaline 951, astragalus, ashwagandha, echinacea, and other herbs or stimulants. How about antioxidants like green tea extract? I'm going to come back to that one. Alpha-lipoic acid or glutathione, really, really important. Iodine, selenium, and zinc in the breast cancer patient, really important. All right. Other nutrients with anti-angiogenesis effects in experimental studies. So we know milk thistle. In the laboratory, milk thistle demonstrated strong activity against a variety of tumors by downregulation of something called VEGF and EGFR. Silymarin is the protein or flavonoid, if you will, that's in milk thistle, and it suppresses VEGF when used as a single agent against human ovarian cancer. What's VEGF? VEGF is a cancer marker that stimulates basically tissue growth. It stimulates blood vessels growing. So VEGF has the potential to regulate how much blood vessels get to a tumor. If we can downregulate VEGF1 or VEGF2, we can actually see tumor cells starving of blood supply. The blood supply can reduce down, and that can be huge. Quercetin flavone inhibits angiogenesis through many mechanisms, including interaction with COX-2, lipoxygenase 5 enzymes, EGFR, the HER2 pathway, and NF-kappa beta, nuclear transcription protein. So quercetin may enhance anti-cancer effects of tamoxifen or other anti-cancer treatments through anti-angiogenesis. Artemisinin, which is Chinese wormwood. It's the active constituent extracted from the plant Artemisia annua, and it's used clinically as an anti-malaria drug. More recently, shown to be cytotoxic to cancer cells through induction of cell death or apoptosis and lowered VEGF expression by tumor cells. It also inhibits the activation of NF-kappa beta, and that kills cancer cells via free radical damage to the cell membrane through an iron-induced free radical. So it helps actually go in actually help the cells denature, if you will, and kill off. Highland 951 is an interesting product. This is something that is actually a fermented soy beverage. It's rich in isoflavones, protease inhibitors, B vitamins, zinc, selenium, carotenes. It's actually been shown to reduce adverse side effects of chemotherapy and radiation in a clinical study involving 318 patients. And it reduced side effects. None of the patients required a blood transfusion, nor did anyone have to discontinue a scheduled course of treatment because of physical weakness. It shows similar benefits to soy isoflavone research in experimental studies with apoptosis, which is decreased cell death, anti-angiogenesis, slow cancer cell replication. Curcumin blocks lipoxygenase. Boswellia blocks lipoxygenase. Ginger blocks lipoxygenase. White willow extract, curcumin, and ginger also block COX inhibitors. These are markers that help contribute to cancer reacting and producing. If we can block these markers, and block these inflammatory markers, then we can see the body healing. All right, circulating tumor cells, or CTCs. So if we can basically bind to CTCs or tumor cells, we can possibly remove them out of the body. So there's a product called modified citrus pectin, or MCP. We use a product called Pectisol C, which is the patented form of modified citrus pectin. It will bind to circulating tumor cells and work to pull them or adhere so the body can remove them. There's also a product called cimetidine. It's also known as Tagamet, which you may have heard of. It's an antacid medication. It also does the same thing. So pectin comes from the peel and pulp from apples, citrus fruits, and plums. It's a soluble fiber and it's not absorbed. Modified citrus pectin is chemically altered pectin, goes into smaller pieces, and it can be absorbed. So that allows it to be absorbed. And there's evidence that MCP could inhibit the spread of prostate cancer and melanoma. It's published in the American Cancer Society. It could also strengthen T cells, which are immune cells. Green tea extract. All right, this is a big favorite of mine. EGCG decreases IL-6 levels. IL-6 is a Th2 immune marker. So it decreases this immune system that is overactive. And it will also inhibit VEGF, which affects the vascularization, or again, think of your veins and arteries basically going to the cancer tissues. So it decreases circulation to the cancer tissues. Sea cucumber extract inhibits aromatase, RTK, and HER2, and this is great for certain estrogen dominant cancers. So EGCG inhibits tumor growth by inhibiting VEGF induction in colon carcinoma cells. That was published in Surgical Oncology. We have a study, EGCG inhibits PDGF-induced VEGF expression in human vascular smooth tissue cells. And that was done in Korea at a major university. These are all published studies. So how do you know which ones you need? Well, the ones that we're going to talk about, the ones we're going to use, are going to be those nutrients that have been published in the medical literature to show support. And this is where we come in. I use individually tailored natural protocols to allow your body to achieve maximum healing. It has to be individually tailored because no two patients are alike. My goal is to help you find the most effective natural protocols to enhance your immune system in its cancer battle so that you have the best chance possible of living a long and happy life. How do we do it? How do we help you? Detoxification and improve your immune system. I do use a modified Gerson. Juicing organic vegetables and coffee enemas can help to detoxify the liver, but let's test you first. Detoxification is very important. We use Rife therapy and ionic foot baths in our office. The light wave is non-electrical wave. It helps to support lymphatic drainage, improve lymphs, and it helps to find and remove toxins in the body. PEMF therapy heals the affected tissues of inflammation. Mud packs, there are interference fields, surgery, scars that are contributing to your body getting sicker. EMFs, even your cell phone, can contribute to cancer risk. How about dental work? If you have a root canal, it's going to contribute to toxins and dead tissue underneath that root canal. I talked with a patient today about that, and I believe that can contribute significantly to poor health. All right, Rife technology uses standard frequencies that are published by the US government and it scans and creates programs. My recommendations help to make sure we know which treatments to work. This Rife treatment allows us to actually help support the body naturally, and we can see cancer really be modulated or improved in many cases by using Rife technology. All right. What else do we do in the office? Brain-based therapy. In my natural medicine clinic, we use oxygen therapy because cancer cells thrive on sugar and lack of oxygen. We do nutrition testing or natural protocols based on lab testing and the use of traditional Chinese medicine. Which supplements help you fight your cancer most effectively? Let's test you and find out. I do neurological testing and we provide neurological support to you. Well, life is a matter of choices. You need to empower yourself and take responsibility for your health. Is the value to you going natural alternative methods and getting better answers? Does this make sense? Or do you want to go down the road of chemo, radiation, surgery as your only options? Remember, the two things that they don't tell you is what can we do to figure out why this happened? What are the weak points in your body? Why is your immune system causing these cancer cells to grow? We know cancer is an immune problem. What's causing it to progress? And even if you go the traditional route, how do we prevent this from coming back? How do we use tools to help improve and heal you down the road? If you like what you've heard, then set an appointment for a consult with my office, because we know information without action is not going to help you. We've got some additional stuff though, right? So a diagnosis of cancer is not a death sentence. My friend, Dr. Connors, Kevin Connors, said it great. We want to take this acute life-threatening condition and turn it into a chronic manageable metabolic problem that we can treat and support. That's our goal. So what can you do right now? You can change your diet. No refined sugar, no high fructose corn syrup, including soda, red meat, caffeine, alcohol, white flour, fruit juices, highly saturated fats, trans fats, all food additives, coloring agents, and preservatives. No junk food, no preservatives. Get rid of the food that's in the bags. Increase the amount of fresh organic vegetables in your diet. No or very limited fruits. Stone fruits once per week. Organic grass-fed meat or fish, very limited if any red meat. And here's the key thing. This is so important for you. So I told you about this diet earlier. So there's a couple concepts I want to throw here for you, okay? Hold on. Let's see if I can do this. Oh, no, not going to give it to me. Now, all right, I was hoping to get a white page to show you. It's not going to let me, so I'm going to try to type it, write it in if I can here, okay? Big term, okay? mTOR. Mechanistic target of rapamycin. This is something we want less of, okay? You guys see what I'm writing right here, right? So we want less mTOR. To get less mTOR, we need to have more autophagy. This is how our body replaces itself or eats itself up. So more autophagy, less mTOR. That equals less cancer. There we go. This is the cure for everybody with cancer. At the end of the day, accomplishing this is not as easy as saying do it. But you know, it's really fascinating. When we talk about diet, one of the best ways that we can actually achieve less mTOR and more autophagy is through intermittent fasting. Going 18, 20, 22 hours a day, not eating, and relying on the production of plant fats, low carbohydrates, but plant fats, high plant fats has the most potential to improve autophagy and reduce mTOR. And studies are showing this will reduce the effects of cancer, autoimmune disease, inflammation, and aging. And this is the key thing we tie our patients to. When we treat our patients, it's all about how do we get rid of each of these different potential things that drive your cancer. Well, diet is huge. Diet is massive. So if I can improve your diet, get you on the right path, we're going to see your body heal. And we're going to see, like the studies we posted on Facebook last week, we have a prostate cancer patient who was told stage 4, he's doing great. We have a patient who has liver cancer. He's doing great. We have a patient who has colon cancer who is doing amazing. We've seen his cancer markers drop consistently since starting care. We have a patient who multiple patients who have breast cancer who we've seen tumors shrinking, tumors stabilizing. We've seen patients years later not going traditional medical routes, doing wonderful. So what else can we do? No glutamine. L-glutamine is a gut healer, but it will help potentially make your cancer worse. Be careful about glutathione and CoQ10. Make sure your body genetically can use them. If they can, they're great. If they can't, don't use them. Go to a sauna, infrared saunas, massage, steam room. Drink distilled water for detoxification. Get out in the sun. Get your vitamin D. Go to Dr. Kelly's metabolic typing book and figure out what you should be eating. Consider using modified citrus pectin, which removes those circulating tumor cells. So MCP would be a multi-billion-dollar drug if it could be patented by drug companies. Isaac Elias is the one who developed it. He's an MD, and instead it's a supplement that we can all buy that is not covered because it's not patentable. All right. Well, I thank you all for joining us. If you have any questions, feel free to ask them. You can visit our website at Akiba or drakibagreen.com. Click schedule today or new patient and sign up to meet with me one-on-one and see if we can help you. There's so many things that are happening in the world right now of cancer research. And I mentioned earlier about some of those things, and I can't emphasize enough that it keeps getting to be more and more options out there to treat our patients naturally and through more advanced medical treatments. I have access to a wide range of different medical tools that your oncologist doesn't think to use about because they don't keep up with the newest research, and I'm exposed to this through my fellowship. There are drugs that are out there that are actually okay to use that can help to reduce inflammation with little side effects. There are other medications that are out there that can actually help to unlock the reason why the immune system doesn't attack cancer cells. It can help us to kill those better. And of course, the supplements. It's a great patient who comes in and says, let's go a natural approach, but you can do that with or without the medical model. And that's the thing, I think, is so many of our patients say, hey, do you have something that I don't want to do surgery? I don't want to do drugs. And we respect that and we can help you. But don't be afraid of certain things. If we find that it's best for you to do an integrative approach, let's look at what works best to help heal you long-term, because that's our goal here. Well, I thank you for watching tonight. I look forward to meeting with each of you, and have a great day.